Okay, so I'm in the waiting room, as you can see here. How much longer? How much longer? Lord, if I got $1 for every time somebody asks, how much longer? But vaginal bleeding. I'm going to talk about vaginal bleeding in the emergency room. Okay, I'm Dr. Jerisa ER. I'm the board certified ER doctor, the good ER doctor trying to help y'all be good patients. So we're going to talk about vaginal bleeding. Okay, because that's like the, kind of the hot topic right now. What is the ER going to do? Because when you call your doctor going to say, go to the ER. And then when you go to the ER going to say, why you came here? You ain't go to see your doctor. Your doctor ain't have no appointments. Like, what we gonna do?
911, what's your emergency?
Because when you call your doctor, they just gonna tell you to come to the ER anyway. What the ER gonna do, child? What we gonna do? I can't stop the bleeding. Okay? But helping you keep it in perspective. Vaginal bleeding in the emergency room, because every time you call your doctor, they gonna tell you to come to the ER. They gonna tell you to come see Dr. Jerisa. This is not medical advice by any means. This is only content, educational content, to try to help y'all understand what you could expect. And also advocacy, trying to help y'all understand what you should ask, what you might not need to ask, because you're going to be asking for that charger. Y'all got a charger? Anybody ain't got a charger? I need to charge my phone. I've been waiting so long. My battery is dead now. I need a charger while I'm waiting here. Vaginal bleeding. What can you expect? Some of the things that we look at, we could tell right away by your history, what you say, how long it's been ongoing, what are your other symptoms. So are you having any palpitations? Are you lightheaded? Are you dizzy? Do you feel like you're going to pass out? Do you have a history of fibroids? Has this ever happened before? Do you have a history of anemia? And yes, how many pads? That's often the question. And that question is kind of, I don't usually like that question. How many pads you going through in an hour? How many pads you going through? It's a tough question to answer, right? Because, that's kind of patient perspective. Well, this one might change every hour and this one might change every 2 hours. So I never really liked that question, But we can look at your vital signs. So we can look at things like your heart rate to see, is this person tachycardic? Do they look like they may be volume depleted, right? Or hemodynamically unstable? Those are the things that we look at. Do they look pale? Their conjunctiva, their capillary refill. There's certain things that we look for when it comes to vaginal bleeding. Can you expect to get blood work? No. Do not. All the time. Expect, I've been bleeding for 2 weeks, that the ER is going to do blood work. No. We look at a lot of different things, okay, to determine, does this patient need blood work today, or can they follow up with their doctor? Is this life-threatening today, or can they follow up with their doctor? Okay, not every patient that comes in with bleeding for a week or bleeding for 2 weeks, when we look at all those things, when we take that history, I don't want y'all to be like, I went to the ER, I was bleeding, and they didn't do no blood work, and and then my doctor told me to go to the ER, and then I went to the ER, and they sent me home, and they didn't do nothing. Well, listen, there's things that we look for. There's like a checklist. We look at things before we even go in the room. So it matters. It matters what you tell the triage nurse. It does matter. It matters those vital signs. That's like key. It matters the events surrounding the bleeding. It also matters, has this happened before? Do you have a doctor? A lot of times if patients do have a follow-up doctor or a gynecologist, that really guides what we do, because we think, okay, and also insurance. Meaning, is it going to be difficult for this person to follow up? If they don't have insurance, you have a little bit lower threshold to your workup, because that person may not be able to get in anywhere. If they do have a doctor, you might know that doctor on staff. You know, okay, I know they'll be able to see that doctor next week. Because sometimes when that gynecologist has done their workup, okay, or the workup that they should do, they will be able to order medication, you know, some depending on what it shows. You know, is it a hormonal imbalance, or is it something like fibroids, or is it something like, you know, cancer that recently came up? But commonly, it's fibroids. Commonly, it can be just a hormonal imbalance. You know, maybe you can have more stress that particular month, and your cycle could be abnormal. And so, we don't want everyone to think that you have abnormal bleeding and you're going to die, because those are the people that get on Google and they get stressed and they get anxiety, and then they come to the emergency room because they need Xanax, and they're suicidal because they think they're about to die, and they think that their life is about to be over. And it's like, okay, wait, bring it down. Bring it back. Bring it back. We see that all the time, okay? So keep things in perspective, but definitely advocate for yourself. Ask the right questions and get in tune with your body. You know, get in tune with your body. You know, blood work can be done. Pregnancy test is also going to be done. That's one of the misconceptions, that people think, oh, well, I'm bleeding, it's my period, I ain't pregnant. Ain't no way. I'm bleeding. I told you. I ain't pregnant. Why y'all gotta do what you need you need my urine for what? I told you I ain't pregnant. You can still bleed and be pregnant. That's why we need it. You could be having a miscarriage, okay? That's why we still need to do a pregnancy test with the vaginal bleeding, okay? Work with us. Let's work together. And then I get you your phone charger in a minute. The worst thing you can do is think that you're going to get an MRI, a CAT scan, an ultrasound, blood work for you, your mama, your daddy, genetic workup, PET scan, full body, check your head because you're coming in with vaginal bleeding. I want to make sure it's not here. That happens. Those can be expectations of some people. And we got to keep it in perspective. All right. The main thing you are going to want to do when you leave this emergency room, because we're going to tell you, we either going to admit or we're going to discharge. And that's what I'm here to kind of help you understand. Is this something where you're going to be admitted for and get a workup and all those things? Or are they going to discharge me and I got to what? Follow up. Okay? Say it with me. Follow up. The ER is not the end all be all. And sometimes people think that they left the ER and we done gave you a good bill of health and you can go on about your merry way. And no, ma'am. No, sir. No. This is just the beginning. Okay? You done use my charge and now you need to go on ahead and follow back up. Call your doctor. Tell them you came to the emergency room where they wanted you to go. And we did what we can do. Now, if you are lightheaded, you're dizzy, you're faint, you feel like you're going to pass out, you're really, really hemorrhaging. Okay, there's bleeding and there's hemorrhaging. Okay, then there's a whole different workup. We're going to do examination. Those patients we will do blood work for. Likely go ahead and get an ultrasound, and you'll likely also be admitted depending on what the results show. Okay, so that's just kind of the nitty gritty of vaginal bleeding. Trying to keep things in perspective, y'all, while you're in the waiting room. I want to say this. Well, I'll probably say that for another video. I think I'll say that for another video. But anyway, for more videos, more educational videos, because I'm going to talk about STDs, because y'all know, did you know HPV, so did you know cervical cancer is caused by a virus? Did y'all know that? Like, some people be like, huh? Yeah, cervical cancer is caused by a virus that is spread sexually. And there's a vaccine for it, but some people like the vaccine, some people don't. I ain't gonna talk about the vaccine because I ain't, we know some people hear the vaccine, they be like, oh, vaccine, you trying to kill me? Like, oh my God, vaccine? Are you ain't sticking no needle in me talking about no vaccine? Are you kidding me? Yeah, so I'm gonna do another video on cervical cancer, because I do have a friend that was near and dear to me that died from cervical cancer many years ago. Not less than 10 though, but many years ago, cervical cancer. I also have a former employee, her mother passed of cervical cancer. And then I also have a high school classmate who is a survivor of cervical cancer. So I've been talking about cervical cancer. I talked about cervical cancer for years. I have even given away pap smears because they changed the guidelines. These insurance companies, they don't want y'all, they don't want us having insurance. I called my doctor to get my pap smear. And they were like, oh no, you had one already last year. You don't need another. And I'm like, wait, what? I don't care. Last year was last year. It's a new year. What you mean? I don't need no pap smear. I'm supposed to get a pap smear every year. Oh, no, they changed the guidelines. Y'all don't change the guidelines. What you mean? Who changed the guidelines? Huh? Who did that? You got people dying out here, and y'all insurance companies, y'all letting the insurance companies lobby and the pharmaceutical companies lobby, and you change guidelines? When people get mammograms every year, you let the men get their PSAs every year. Why we can't get a pap smear every year? What you mean? You can get it, but the insurance company might not pay for it. What? Okay, anyway. So that's vaginal bleeding, nitty gritty. Stay tuned. Follow, whatever, like all that stuff. I'm just gonna be doing some content. I ain't thinking about your comments now. I don't care about no comments. I don't. It's straight content, educational, not intended to be medical advice.
911, what's your emergency?